I mean, I think it's very important and essentially similar to why, assessing the hemodynamic significance of a lesion is important in any case. I think particularly with restenosis, it can be angiographically quite ambiguous. So you may have a hazy appearance. It may not be particularly angiographically obvious whether it's flow limiting or not. Obviously, you can use imaging, but probably a better way of assessing whether the lesion is ischemic is to do a pressure wire assessment with physiology.
And in fact, when we look at the other two cases and we look at our algorithm for stent failure, if it's very severe or critical disease, then you don't really have to necessarily do a pressure wire. And the second case was obviously a chronic occlusion, so clearly it was an occluded vessel, and the latter case was a very critical lesion. So you don't always have to do it, but I think where there's ambiguity, as Johanka says, it's the best technique. I hope we showed that in all three cases that the intracoronary imaging really gave a better understanding of the mechanisms. And going back to our chart, I think you have to really have it at the very top of the tree to really understand what's going on, because there are a variety of mechanisms, and all three cases illustrated ones that we recognised and some we didn't really understand, even despite the imaging. Question leads very nicely on from why we use intracoronary imaging, because I think, once again, going back to our algorithm, it tells us which device to use. And often we have to use a combination of devices. So I think lesion preparation, key, you've got to understand where the problem is first. In the first case, it was a combination of using all the tools, laser, angiosculpt, and non-compliant balloons. You don't really know which one's giving you the biggest effect. But we know from the previous case where we didn't use those extra devices, we didn't have a very good result. So that's how you have to sort of program yourself to keep seeking out which device to use. But if you don't prepare things properly, then the patient's bound to come back.